All right, I'll go ahead and get started and folks can jump on. So, hi everybody. Thank you for being here today on Wednesday, November 5th. My name is Stephanie Kucher. I am the Quality Improvement Coordinator here at Stark-Mar, and I'll be kicking things off today. So again, this session is being recorded, and so please, just as a reminder, we're unable to accept any AI, like a note taker in our session, so we will be removing them if we see any. And we can go ahead and get started. So again, this session is recorded and will be uploaded to our YouTube channel. So the link should be made available on our webpage shortly after today. So now that the RFP has been released, and because this is a competitive process, questions about the RFP can be asked in these Q&A sessions or through our designated email address, which is rfpquestions@starkmar.org. So all questions and answers will be transcribed and made available on our website. So there will be time for questions after going through each document today, and then at the end of the session today. This is the only Q&A session out of the 3 that will walk through every single document. So the other 2 will just be highlighting updates from last year to this year. So we figure we would offer one where we walk through everything, just in case you want that information, you need that refresher, or maybe you're new to working with us. So Melinda sent out an email on October 6th with the information for the Q&A sessions. But if you need a refresher on those or what's not on that email, the other 2 Q&A sessions will be on Tuesday, November 18th. And those are shorter since we just highlight the changes from last year to this year. So that one on November 18th will be from 3 to 4 p.m. And then the last one will be Monday, December 8th from 10 to 11 a.m. So these dates and times are also listed on our website, www.starkmar.org. And from the homepage, you can click on the button that says RFP information. So Melinda will send the links for the other 2 sessions like she did for today. You don't have to attend those if you don't want to. You can if you want to. It's totally up to you. You can also share those links with others within your organization if you think someone else would benefit from that information. And the other 2 Q&As will also be recorded and then posted on our YouTube channel. I'd like to start just by I'll be sharing my screen a lot throughout the session, so bear with me as I go back and forth. But I like to share just a screenshot of a quick rundown of our RFP process, maybe for folks who might not be too familiar with it. So one moment while I share. So I just put this together to give folks an idea of our time frame. So early November, we released the RFP. Because it fell on a weekend, we bumped it back to releasing on Halloween. So that is where we open up the application process. So November through December, we're hosting our 3 Q&A sessions. December, you may know the RFP is due back to us on Monday, December 29th. And it's when we receive them that we start immediately checking for any missing information. And then we start reviewing Ohio MOS certifications. January through March, once providers have submitted all required RFP documents, we begin our actual internal reviewing and scoring process. So RFPs will be assigned to Stark-Mar staff who will fill out a scoring sheet on their end for each RFP. And if you're interested in submitting a proposal for consultation or prevention, we call that CMP.
That one right
For
there.
CMP programming, that chart that you'll need to fill out will be emailed on January 2nd. Excuse me, with a due date at the end of February on the 27th. April through May, that's when we meet with every provider who submitted an RFP. And so we go over the results of the RFP review process and share our funding recommendations. So if you submit a proposal, you can look to receive an email about scheduling a meeting in April and May. April or May, sorry, just one meeting. May and June, so after we meet with all the providers, funding recommendations are taken through our board committees for approval. So it's important to our board members that we meet with every provider who submits an RFP before they start to see and review our funding recommendations. And then in June, that's our full board meeting, where that's the final recommendation for allocations. And in 2026, it'll be on June 25th. So it's after that date where provider contracts and allocation notices will go out to those who are approved for funding. And then we would ask for signatures on those documents to be submitted back to us. It's usually early mid-July. So I just like to share that just to give you an idea of the time frame in our process. So regarding the RFP documents, if you had not received the email with the RFP documents, or maybe you can't find it and you need to pull up the RFP forms, you can pull them up on our website. Again, www.starkmar.org, and click on RFP information. So this is the same place on our website, again, where you can access the link for the recorded sessions, as well as the transcribed questions and answers that come up in this process. All right. I think that's all I have in terms of an intro, so we can go ahead and take a look at the forms. So I like to start off with just our kind of supplemental documents that are here as resources for you. These are references for your information, and they don't need to be completed or submitted. So I will pull up our first one. And again, these are the ones in the packet that are PDF format. So I will start and just give you a visual. I'm not going to walk through line by line every form, but just at least show you so you can put your eyes on it. This should be named Stark White Paper. So you'll see this really is a philosophical reasoning behind efforts to prioritize populations, programs, and providers who are applying for limited resources. So this has been a document that has been included in several, since I think 2015, several releases, but it was revisited and updated a little bit this year with clinical ethicist Dr. Michael Gillette. And that was part of our strategic planning process. So in our strategic plan, in our current one, we wanted to take a look at our RFP forms and processes to make them more efficient, make sure we're asking things that we actually use, all in an effort for improving that process on your end and honestly on ours. So this white paper, it's just 4 pages long. I'm just going to scroll so you can just see. You can go ahead and take a look at that and read it if you're interested in the prioritization categories. Hasn't changed too terribly much, but it would be worth just taking a look at. There's also additional considerations on where higher priority may be given. So that last page could be a good reference for you as you're developing your proposals. Stop sharing that one. And working on multiple screens here, so I'll be looking to my right and left from time to time. We have a terms and definitions PDF. And I'll share that with you so you can just get a visual. So this is really, it's a non-exhaustive list, so it's not all encompassing, but it's terms and abbreviations that you may encounter in this RFP process or in your work with StarkMar. So I know we use a lot of abbreviations, and so we included some links for you in hopes to give you more information if you need it throughout this process. All right, 2 more PDFs to share with you all today. So we have here our school-based mental health consultation frequently asked questions. So this really encompasses common questions and answers that have come up around providing school-based mental health consultation services. So if you are interested in submitting an RFP for consultation, this is definitely a good resource. It is 2 pages. We have a couple links in there for you if needed. And then the last PDF is our evidence-based models and practices handout. So this lists models that are approved and supported by StarkMar. So it's a non-exhaustive list, but can give you a good idea of what is supported by StarkMar. We have links to all of the models. It is broken up by, you'll see, by program, and then there are prevention models. I'll just scroll really quick, and then I believe the rest is treatment models. So depending on the type of programming that you'd like to submit, we try to categorize it so that it's easier to navigate. So that is that resource. So now we're getting to the forms that actually will need to be completed as part of the RFP submission. So I will make sure to point out changes from last year to this year, but also still kind of walk through our forms. So the first one is the face sheet, checklist, and guidelines. All right, here we go. So new this year, I just added a table of contents just for easier navigation. It mimics what is in the guidance document where you can hit Control and then click on the link to be taken to the page in the document. And you'll see these first 2 lines, it says to be completed and submitted with the RFP. So hopefully that catches your eye. So we need that face sheet. We'll hop to that next, completed, and then the RFP checklist. So hopefully this is a good reminder for you on the 2 forms in this document that need completed and submitted. And then the rest is just information for you as you're going through this process. So I'm going to scroll down. And so here's the face sheet. And this is the first page that we will need filled out and completed, submitted with your RFP packet. So this has not had any changes from last year to this year. Really just asks basic information on your organization, submission type, first time you're going to submit this to us for SFY27, you'll hit original. Sometimes we may need a revision submitted, and that's when you can select this box, but you can always hit original. And then you can click on these gray boxes and type in your information. And we do actually reference this page a lot. I know it's a page that even our admin department uses because we take a look at who's the contact in terms of the executive director or the fiscal officer or the clinical director. So this is a really useful page for us, honestly, in terms of who to contact. And so we do ask for a signature here for your board president or chair, and then the executive director. And this RFP checklist, that's the second and only other page in this document that you'll need to complete and then submit as part of your packet. So you can go ahead and click in the gray box again, type your agency name, and then we did include the email address on every form just to let you know where to submit everything. I think we got feedback last year from a newer provider who wasn't sure where to submit things. We made sure to put the email address on each document. So you'll see some language here. So this is, the colors really are separate for each program type. So the gray here is for all programs. So take a look at these and you'll see, except for those that qualify for the expedited RFP. So the expedited RFP is what used to be known as the waiver. So if you're familiar with the RFP waiver, that has been renamed with our work with Dr. Gillette in our strategic planning process. It's the expedited RFP. So that's one change this year, just the language change to better reflect the process. But you'll see here, we list the documents that are required for all programs, and then the format is in parentheses. And you can go ahead and click these as you include them in your packet. So the face sheet, you'll see some notes here. That was the previous page. RFP checklist is this page. And so we do ask for these other documents. So you'll see your vision and mission statements, your table of organization. And then we do have notes here. So if all staff are contracted, we have just include the executive director, the roster of board members. So please indicate board officers. We do ask for a PDF of your current accreditations and certifications. And then the subrecipient risk assessment, which we'll walk through later. So we also have this section here, requirements for specific services and providers. So you'll want to take a look at the notes section especially. So there's an inventory template. It's only going to be sent out to providers who have inventory, so it's not very common. We do ask for an audit or fiscal statement, your most recent one, if you're a provider who's applying and are not currently funded by StarkMar. And if you are submitting a proposal for a program that has a bed, we do ask for the address of each site with the number of beds. And is that Julie? Yep, go ahead, Julie.
Hey, I got a question, which I can barely remember because all that. Shit. What were you just talking about, man? Oh, I know what it was, the audit thing. Hey, I don't know about other people, but in our world, since there's not government guidance on certain aspects of our audit, it is not able to be completed as yet. So I don't know if that's just a COC thing or if others are having that, but our most recent may be last year's again.
Yeah, just to let you know, we work with our auditors. They can issue an audit report. They just can't issue the SFY, and there's a cross-reference that they can do so you can get your audit report done on time.
Say that again, Thomas. You kind of was breaking up a little bit there. You said something about
Yeah, so there is an exception that allows the auditors to issue your audit report, but there'll be a cross-reference because they can't issue the SFY because the guidance hasn't been finalized by the federal government, but they can issue the audit report with a cross-reference to that commentary.
Half reference to what?
That basically that they can't reference the SFY as being completed in that audit report.
Okay, thank you. Thank you. So, go ahead.
Thanks so much, Tom. All right, and next, so if your proposal and your program includes a class or a group, we do ask for a curriculum evaluation form to be completed, and we'll walk through those shortly. So again, those are just real specific if they apply to your program. So if they don't, you don't have to submit those. So going down to this blue area, it's just applicable to consultation and prevention. Again, C&P, I might say that acronym as we go on, programming. And so that's in addition to the gray section that's required for all, but you'll see the narrative and budget. So the narrative itself is due by the typical due date, the Monday, December 29th. Budget can be due later by noon on that February date, along with the personnel cost schedule. If that works for your agency, sometimes folks submit the budget by the December due date because that works in terms of getting all the programs on that form. So I think current C&P providers, we've done this for a couple of years. So, these due dates are pretty similar to the past. You'll see that C&P chart that outlines the different schools and or childcare locations where you'd like to provide services. That will be emailed out again January 2nd with a due date of February 27th. And if there's any government entities and recovery support RFPs, this green section applies to you in addition to that gray one up top for all providers. So the RFP narrative and budget and the personnel cost schedule for any staff on payroll. Treatment providers are in the orange, again, in addition to that gray section above, applicable to all. Same thing with the RFP narrative and the personnel costs. And then the expedited RFP. So if you qualified for that expedited RFP, you would have already been emailed. We asked for that form itself to be submitted, along with the personnel cost schedule and then the curriculum evaluation, if that applies to your program, if it includes classes or groups. We do ask for that form as well. And then you'll see wording here at the bottom. Nothing further in this document needs to be completed, so the rest is just for informational purposes. But we'll go ahead and scroll through quickly, and I'll just outline for folks who may be newer to this process what we have in this document. So we do have a section that talks about accreditations and certifications. So, and you'll see we did change Ohio Moss's former name to Department of Behavioral Health. So you'll see DBH in all of our forms now as opposed to Ohio Moss. And so we do ask that programs that are included in your RFP submission are certified by DBH. If you are working on certification and you're still in process by the time our RFP deadline approaches, you can still apply. You can send us like a printout from their portal that just shows that you're in process and keep us up to date on that certification piece. We do ask that the certification be in place by July 1st so we can enter into contract for services. We also have language here. If a provider has not previously been certified by DBH, I have to get used to saying DBH, DBH for services, the provider can work with an already certified provider and work together to provide those services. So if both organizations are in agreement about that arrangement, the organization that does not have the certification would not need to obtain it because they would be kind of under that umbrella of the certified provider. This information in the bullets here kind of came up it may have even been last year's Q&A. So we put these in bullet points to give some further guidance. So both providers, again, must be in agreement about the collaboration. Certification for the certified provider must cover the services to be provided by the partnering organization. The RFP must be submitted by the certified provider, and then StarkMar must be informed of the partnership. So if you establish an agreement with another organization at this point, since it's after RFP release, you can inform us even through that RFP questions email, just so that we have a heads up. Because it's prior to release where we can have individualized conversations with providers, but once release happens, because it's a competitive process, we're not able to do so, and the method to ask us questions changes. So, and you'll see this RFP questions email probably throughout a couple documents for you. So we also have verbiage here that providers must have a physical brick and mortar office space in order to submit an RFP. So the program must be based in Stark County in order to be considered for funding. This page is really more of an announcement, just with the facts, the release date, the due date, how you can submit it to us, along with non-discrimination disclosure. This board planning section really talks about StarkMar's role as a planning agency for Stark County residents. It hasn't changed since it aligns with Ohio Revised Code. So you can go ahead and review that if you're interested in our part in evaluating and planning for services. So the purpose for requesting information, you'll see again reference to ORC and a link if you'd like to visit that. And we just share that the RFP isn't a formal contract proposal yet, and it talks about final decisions resting on our board of directors at the June meeting. Obviously, decisions of StarkMar on the allocation of funds are final and obviously contingent on state funds. Information review process. So just some expectations as you're working on this process. And our role here, let's see. Yep, and just a reiteration of sharing the information with committees of our board. So the annual request for proposals process, this talks about what we'd like to see in requests. So you'll see serving one or more priority population, and that aligns with that Stark white paper that I showed earlier. And evidence-based programming, again, you can double check that similarly named PDF to see if you're using models that align. And that's it for that page. Okay, we have our chart that you'll probably see a couple more times. This outlines the priority area. So it goes 1 through 6 on the left-hand side here. And then it breaks it down by service type. So you'll see what a priority area 1 looks like for consultation and prevention, but then also for treatment, recovery support, and government entities. So because those are very different services, that table is split out to describe what it looks like for each priority. And that hasn't changed from previous years. So a little more wording here around the priority populations. And just some general instructions. We reiterate some due dates for your, just for a reminder. We have fiscal forms. There is an instructions tab on the RFP budget and narrative, and we'll look at that here shortly. So you'll see the purpose of the budget. We add here that kind of information we'd like to get from that. And that will finalize the mechanism for billing towards the end of the fiscal year. There is a separate personnel cost schedule, and underline here just to stress only one personnel cost schedule is needed per agency. So you don't have to do one per program. That's a lot of work and a lot of documents. So just include all your programs in that one document. We do have instructions for you, and we'll walk through that here shortly. And because of the change in how the budget looks, we're not asking for certain information. We do ask for at the end of the fiscal year, so we will require program actuals be submitted. And our fiscal department advises that you can use a P&L by program or any internal format that you prefer. So we can provide a template too if requested. So that's a little change this year, just due to the changes in the RFP budget that you'll see. That C&P chart that will go out very early January for consultation and prevention services. Again, just sharing the date again, and based on the services that you intend to provide, you would fill out the applicable tab. So we will have a tab for school-based mental health consultation, early childhood mental health, and then behavioral health prevention. That form is currently in a draft version at the moment, but it'll be finalized and ready to go by early January. We do have the same naming convention as previous years, so that has not changed. So you can save your RFP narrative and budget document according to this naming convention. So if you are submitting for a program that is currently funded, you can include the MIP program code number, program name, narrative and budget. And so here's an example for you with forensic services. So if you're submitting for a program that would be newly funded by Stark-Mar, not currently, we're not currently funding it for you, you can name it new program name and then narrative and budget. So let's say it's a new forensic services program. We have an example there for you. And that just helps us as we go through the RFPs that have been submitted, so we can file them appropriately as well. And hopefully that helps you on your end as you organize your files. All right, the subrecipient risk assessment. This has been the same as previous years. So this is a questionnaire required of all providers. It assesses different factors to determine risk of noncompliance in accordance with our subrecipient monitoring policy and procedure. And we'll look at that form here later in this meeting. And then the last page is around the expedited RFP and what that entails. So we have the criteria here. to be considered for the expedited. And then in order to move forward with that, you would agree that there's no changes to the program from prior state fiscal year to current, and that any change in the funding is within 10% of the budget. And then we would just reiterate, we still want to see that personnel cost schedule, and then that curriculum evaluation if that applies to the program. And then a complete RFP submission is required once every 3 years, just so we can get a full picture of the program if you had a couple years in a row of qualifying for the expedited. And that's it for this document. So I'll stop sharing, take a look at you all, see if there's any questions. All right. Doesn't look like there's any. Next will be our RFP guidance document. And this document really, you don't have to complete anything within it. It is just that, a guidance document. We will walk through the different sections. It's quite lengthy, but hopefully it's a good resource for you as you're working on your RFPs. So for folks who may not be familiar, I'll do a quick walkthrough as well. So we also have a table of contents here, and the blue font is their links. So you can go ahead and hit Control and click to get wherever you need to. For the sake of this presentation, I'll just be scrolling through. So you'll see here, we start off just by sharing the purpose of the guidance document. So we want to outline our philosophy regarding program and service expectations. So we hope this informs the RFP responses from providers and lets you know our expectations of different service types and programs. We do have a section here, again, describing our role per the ORC, and that's an active link there, as a safety net, and also how we plan and assess community need under ORC. We do have priority populations here outlined, and we align with what is in the Ohio Administrative Code when it comes to the populations. So we have the link to that page, but then also outlining here, just for reference, SMI, so adults with serious mental illness, SED, serious emotional disturbance in youth, and then substance-related and addictive disorders. So this would be a good section to reference if you are submitting for a program that provides alcohol and drug services. Again, we are a safety net of services. We do talk about how local need is assessed. And there's our chart again of our priority areas. So expectations, this section talks about requirements for RFPs, what we would like to see. And you'll see here, you know, obviously meeting all federal, state contract requirements and any applicable standards. So take a look at that section. I'm not going to read every bullet for you, but that's definitely a good reference as you're getting ready to submit your RFPs. I don't think there's any changes here yet. We do have this page here. It shows preference or higher scores will be given to the following programs and services. And this has stayed the same. And you'll see some examples about providing trauma-informed care, programs that are comprehensive based on current research, within the parameters of the mission statement. So take a look at that list as well. And then we get to some specific programs where we outline expectations and information. So we start with permanent supportive housing. And I believe there was some updates to this section. So if you're providing PSH, you want to take a look at that. We outlined some expectations for crisis and crisis stabilization unit services. That hasn't changed this year, neither has the integrated care, but take a look at those sections that apply to the programming that you plan to submit. We get to some criminal justice collaboration specific programs, so you'll see expectations for Polaris program. I'll just keep scrolling. Jail liaison, forensic services. And then we get to recovery support services. And we did add a section here for drop-in services if you're interested in submitting a proposal for that. We also outlined some unchanged expectations here for guardianship. We get to peer support services, and you'll see a Venn diagram here that shows the different types of peers that can provide services in the behavioral health system, and then where they may overlap. And you'll see the bulleted list here on the right-hand side kind of sums up the role there. So if you have programs that incorporate peer support, take a look at that page to make sure that aligns with that. And then we have this page, which is differences between peers and case managers, because sometimes that can get a little confusing. So we have some links here to code to hopefully help and be a resource to you if you're checking this section out. You'll even see approaches and activities that can be shared by both roles, and then how they can also help and complement each other. A couple more program-specific sections. We have early childhood, mental health services. So we're in the consultation and prevention part when it comes to services. School-based services, and then prevention. And you'll see the different types of prevention strategies listed here. And then we have our table with our priority areas related to consultation and prevention, so just specific to those services. We have a section here on zero suicide with some updated stats. And we continue to include the 7 essential elements. So you'll see those are links if you're interested in learning more about those. And then you'll see some expectations around zero suicide efforts and using tools like the Columbia and Stanley Brown. All right, evidence-based practice. And so this just references that supplemental PDF that we looked at earlier, and just summarizes that, you know, it's non-exhaustive, but take a look and see if you're providing services that align with models that are outlined in there. That will help strengthen your proposal. We continue to include our table here on Triple P if you are interested in providing that. We would not consider it as a standalone program. So you'll see here that we we outlined that level 2 is considered prevention, and then 3 through 5 are treatment. So thinking of these courses, if you're including them in your proposal, just hoping to give a little more guidance on where to include it in existing programming. So we have an outline here of the types of groups that Stark-Mar may fund. This really hasn't changed from previous years. We have links to Ohio Administrative Code if you're interested, and we outline the purpose of each type of group, along with other items such as the number of members, just things to keep in mind if you have an RFP that includes classes or groups. So we have treatment, prevention, support, and education down here. And we're getting to the outcomes section. So this wording here talks about how we use the outcomes information. So once approved for funding, we ask for outcomes on a quarterly basis. And so this talks about how we use that information, how we share it. And we have a table here that outlines all of the currently funded programs and their outcomes. So if you are submitting a proposal for any of these programs, please take a look. Look up your program. I think we did update a couple programs outcomes. So take a look at these before submitting your proposal. It's quite lengthy since it includes all of our funded programs, but I'll just share that we have it split up by program type. So we have consultation and prevention, so those C&P program outcomes. See, so you'll see BH prevention in the outcomes here. Early childhood mental health, we call it ECMH, and then school-based consultation is BMH. And then we get to recovery support services and government entities. And I'm going to just scroll through. So if that impacts your eyes, look away for a moment. All the programs are listed alphabetically. Okay, then we are at treatment program outcomes. So what we have is continuing to align with the 6 OBIS outcomes for adult and youth treatment, and they are right here. So we do ask that you propose percentages in the RFP narrative for each applicable outcome. And we understand that not every outcome statement will align with your treatment program. So for example, if you are not providing any alcohol and drug treatment services, this outcome number 5, you can add a 0 in your narrative, and we would understand that. So I think that's the example cited here. So we do have some other programs, even ones that might fall under the treatment category, but they have different outcomes due to the services provided. So we have those outlined here in this table. It's a much shorter table, but these have been pretty consistent the past several years in this separate kind of table. And that is it for outcomes. So request for proposals. You will see some general information around expectations as you work on your RFPs. So you can take a look at that section. Mandates. So any mandated services that you are provided, we ask that they're clearly identified in your proposals. And so you'll see a little more information there. When it comes to training, we do talk about in this little section what would be approved costs for training and what would be acceptable to include in the budget, and what will not be funded. So if you're interested in that, you can look at that section. The scoring, we did take out some language around here as we worked on our strategic planning. One piece being it talked about full and shortened RFPs. At this point now we have one version, and so we don't have a reference to two separate RFPs with separate thresholds. So this section got a little more shorn up to better reflect the process this year. And you'll see a list here. Proposals that do well on scoring are those that address or include the following. So you'll want to take a look at this bulleted list. Flex funds, this section is unchanged from previous years. So this is separate funding outside of the RFP to assist clients from discharge from the hospital, CSU, jail, prison, residential, and to prevent readmittance or rearrest, and also to help support the recovery for the clients. So applications should come to us from the treatment provider if the person's open to treatment. And you'll see some more guidance here about different collaboratives that should be ruled out prior to seeking out flex funding, as well as program priorities. It only is available to those 1 through 4. And then we have some items here listed. Again, this hasn't changed from previous years that will not be reimbursed. So you can take a look at that. Flex funds used to be an item to include in your program budget. And so for a couple of years now, it has been removed. So we just have this in here as a reminder. You don't have to put those costs in your budget. That's an internal line at Stark-Mar. Of course, there are some programs that are exceptions because they bill heavily on client supplies, and those are outlined here specifically. So that would be your PATH, your recovery support, and community linkage programs. So we understand that those will be included in the program budget. All right, hardship funds. So those are used to cover private copays or deductibles for clients who are not eligible for Medicaid. So if you're interested in accessing these forms to fill out for clients, there are 2 forms available to any treatment provider who's interested in accessing the funds. So there is the copay waiver form and then the potential Medicaid waiver form. So the potential Medicaid waiver form, you can access it at that link that's in there. And then the copay waiver form can be accessed upon request by emailing SmartCare. And the reason we don't have a direct link for that form is because I'm told that not all board areas that work with partner solutions have this copay waiver form. And so it's not something they want to just have available, especially if it's a board area that will not use the form. So but you can email SmartCare support. They're very responsive. That email goes to several partner solutions staff so that the person who is most available can address that email and get you what you need. Interpretive fees. So this may be requested in a program budget. So this is something you can include if you have if you anticipate costs associated with an interpreter. There are funds to be billed on units. So if you have a rate sheet, we can include it in your rate sheet. And you can bill us to the actual amount that was spent up to the max rate. So you'll see here the service code number and name in the program budget. So you will select that when we get to the program budget. It may make more sense. And here's the name of the code. The max rate is $40. And so we do have restrictions. Again, this information hasn't changed from previous years, but we ask not to be billed for transportation, time, or cancellation or no-shows. So that is something you can include in your budget if you foresee that being a need. Fiscal guidance. So you'll see programs will score higher in the RFP process when the total indirect costs do not exceed 45% of the total program cost. We will be utilizing the same coding and reimbursement rates as Medicaid for all Medicaid eligible services. And we will work with the provider to set up either procedure codes to bill on units, or if we need to come up with custom codes that we develop on our end. And this last paragraph talks about the listing of any inventory that are on record. Again, that is really rare, but we'll reach out if it applies to you. Billing. So we do have some providers who bill on actuals, but we do try to move folks to unit-based billing if that's feasible. You'll see here we talk about our Smart Care adjudication program and moving towards that if possible. Reimbursement will be paid based on a sliding fee scale. And then you'll see some parameters around that. So not billing StarkMart for insurance reimbursable services due to the provider maybe not being paneled with the client's insurance company. And we do have a StarkMart coverage of benefits to help break down certain scenarios when there's other payers involved. So you'll see on the next page, we have a chart that outlines it, but we have some bullets here. We will only pay for services for residents of Stark County, and then we have a link here that supports that. You'll see we request that other payers be billed first if they have that type of coverage. And then there may be situations when a third-party payer will not pay for services, and that's where this next page comes in handy. We describe different reasons maybe a third-party payer may not pay, and then what our role is in that scenario. I don't think this has been updated since last year, so no changes to this, but take a look at it if you need that as a reference. We also talk about prior authorizations, billing us for services for a client who may be in danger, such as a domestic violence situation. And then lastly, just reiterating the how you can ask us questions now that the RFP has been released. Again, there's that RFP questions email address for you for reference. And that's the end of the guidance document. So I'll pause and see if there's any questions. All right. We can go ahead and move on to our RFP narrative and budget. So this is really essentially your proposal. It's the main document in your RFP. So let me share my screen. Oh, you know what? Before I do that, I just want to make a point. I just looked at my notes. So we had a pre-release preview on October 22nd that presented this, what I'll show you, this narrative and budget, because it looks so different from past years. Again, that was due to our strategic planning process. So that pre-release preview was recorded but we chose not to post it due to some updates to the form that happened after the recording. So we didn't want to cause any confusion by posting that and then posting these Q&As that have a little bit of differences. So if you're wondering about that pre-release preview, we will not post it, but we will post these Q&As. So rest assured that I just wanted to address that. And now I'll share. All right. So when you first open up this document, you are taken to our instructions tab. There's a lot of information on it, but we hope it'll be helpful for you. So what we did, again, we added that email address here for you for easy reference. So we included the why as to why this looks so different, what went into this process. So you can see that here in this first paragraph talking about our strategic planning. We do have a statement here just reiterating it's important that fiscal and program staff work together to spend time on developing RFPs to ensure clear and complete responses and also alignment between the narrative and budget sections. So this in turn should yield higher quality RFPs, which tend to receive higher scores in the StarkMar scoring process. And this bulleted list is straight from the guidance document, just reiterating some points on proposals that tend to do better on scoring and what elements they contain. And then you'll see in bold here, please see the sample RFP, for example, responses to questions. So we do have a sample in this other tab, should you want to reference that. But the rest of the document walks through every single question, kind of like previous years. It looks a little different, but we try to give some explanation here for you on the different sections. Sometimes we try to include like the why or how we use the information. We did add this note for outpatient treatment services. And so we wanted to add how we categorize outpatient for youth and adult. So it's either by intensive or non-intensive. So the difference is the addition of CPST, or Community Psychiatric Supportive Treatment Services. So intensive services would have CPST services and non-intensive would not. And we have this visual here that just shows, you know, in case you're a visual person like me, this image really just shows that. And so if you're interested in submitting a proposal for outpatient treatment services, whether youth or adult, this is a good section for you to reference. And hopefully that image kind of helps clarify how we categorize outpatient treatment services. I think the rest, I don't think there's any new information added. So I will save you the eye fatigue from me just scrolling through that, and I will jump to the actual RFP form. I will magnify it to make it bigger for you all, but zoomed out, you kind of get a picture. So here's the narrative information right here on the left. And then on the right, we have the budget, and it starts with operating costs. And so those are side by side, and that's intentional, again, in hopes to encourage program and fiscal people to work together on the RFP and for each side to really see the other to make sure that it's a comprehensive proposal. And let's see. The narrative piece is longer vertically because we heard that some providers like to print their RFPs out. So we hope that all the columns will print on one page for you this way. So that's why the narrative is longer vertically. So I'm going to zoom in on the left-hand side, the narrative, and before we get to the budget piece. So let me just zoom in. Hopefully it is a little better on your end. There we go. Okay. So contractor name, you would type in the name of your agency. The budget period would be for SFY or state fiscal year 27. So that would run July 1st of 2026 through June 30th of 2027. So weird to say those years, but that is state fiscal year 27. And then the date you submitted, you can just enter that. Program type, that is a drop down, and it would be consultation and prevention, recovery support, and if you're a government entity, you can hit recovery support, or treatment. So you can choose from those. I'm just going to click. So program name, we did load this drop down with currently funded program names. You can also type in. So I'm just going to do this new program. I don't have a name, but just to show you, you can type in if it's maybe a new program or one that is not in the drop down. So we do ask for a basic description of the program. We limited that to 500 characters. We just want a snapshot of what your program entails. And actually, this information is really helpful maybe for several reasons. For reviewers to get that summary of your program. But really, if we bring on new StarkMart staff and they look through RFPs to get acclimated with programs, this will help give them a good, just quick summary of your program. We also use this specific question to present RFP information to our board committees. So once we start moving funding recommendations their way, we do include this basic description just so that they know a little bit about the program as they're reviewing. So we do ask for the age ranges served in the program. So you can go ahead and hit the checkbox next to the applicable ages. And we do ask for the wait time to begin receiving services. And we do have some guidance here, thanks to a good question that came up in the pre-release preview. So for treatment programs, you would select the wait time to the diagnostic assessment. You can go ahead and select whichever most closely applies to your program. And then what's the average wait time between initial assessment and first appointment? That's a drop down. That is applicable to treatment programs. So if you are not applying for a treatment program, you hit that option and move on. Otherwise, you can go ahead and select the best represented time frame for your program. We do ask how many people do you expect your program to serve? Be served total in the fiscal year, regardless of funding source. So this includes StarkMart funding. This also includes Medicaid, private insurance, regardless of funding source. And that is just an area you can type in. So you just type in your number there. We do ask how many will be served with StarkMart dollars. That will be under these. If you remember from the guidance document, we teased those out towards the beginning. So how many do you think will be SMI? Then you can go ahead and type that in. SED, severe substance use disorder. Co-occurring between substance use disorder and SMI or SED, and then other. And then this column here, that'll just add and calculate for you. So don't worry about that piece. It'll total up the number to be served, and then it will calculate the percentage of StarkMart dollars as well as SED and co-occurring, because sometimes we get funding that can only be used for substance use related services, and then also other. And We also look at and ask for the most commonly used substances for the population served in this program. So that is just a box that you can type in your response. You can type NA if it's just a mental health only, but we are interested in the most commonly used substances in the population served. So before I move on to this essential elements section, I do want to highlight some changes from last year to this year. And so we removed several sections as part of our strategic planning work. And so we removed the length of stay question, the demographics question. You need to remember the geographic area and locations, the max number of people who can be served at any time. We removed that strip of data that was asking for the percentage and number of priority areas served and like what percentage of the budget that was. So that was taken out. And then we expanded, if you are a currently funded provider, that question 6, which was that big empty and open text box that really asks for just the detail of your program. So we broke that up into separate questions, which is what we are going to see under this essential elements section. So when we had the big open text box, we had prompts for what we would like answered in our instructions tab. And we thought that to save you from flipping back and forth between instruction tab and the RFP form tab, that we would include the prompts on this exact page. So that's why we broke out. It might look like more questions in the narrative, but it's really what we've been asking. So we hope that this gives you more specific guidance on needed information. So I will scroll down. So you will see here, see, this is question 6. Now it's much smaller. But what specific services will be provided? And then again, check the instructions tab for further guidance. For treatment programs especially, we'll want to see an alignment between what's here and then what is in your procedure code drop down. So we're looking for that specificity. What types of staff are involved in the delivery? And these are just boxes where you can type. So comparative advantages. So what sets the program apart from other similar programs in the community? And then what's innovative over what others typically do or over what you have done in the past? So you get to highlight those areas specific to your program in that section. Delivery strategies. So we do ask how customers are engaged in the program, and what if someone becomes disengaged in the program? What do you do? So we left a lot of room here for you. How do customers flow through the program? So what's that process look like? Oh, Julie, I see your question. Will we be able to print this doc so that we can see the info we entered? In the past, we have printed it. When we have printed it, only shows whatever's in the box, not the rest. I don't have an answer for you, but I'm curious what your experience will be. So if you're able to tell me if you go and try it, I'd be interested. So hopefully breaking these questions apart will lead to shorter answers within each box, if that makes sense. So my hope is that when you print it, it'll show everything that's in the box. But I would be curious to know that. Yeah, great. Thanks, Julie. Appreciate that. So what aspects or special strategies of the program motivate or encourage the customer to do the work, necessary and move towards the performance target, outcomes, successful program completion? So if you went to the pre-release preview, this was a couple different questions, so we made sure to merge them because they kind of overlapped. So we made that into one question. So that was a change. So again, didn't want to cause confusion by putting that other recording out there, but this was one example here of a change. So for returning providers only, so if you are currently working with us this current fiscal year, please explain any programmatic, personnel, and service delivery changes for the new state fiscal year. So if your program is really is mainly paying for staff costs, you can include, any increases perhaps in benefits. I think that's usually a common reason for a difference in an ask. This is the section to use to describe any changes. And this will help us as we review. If we see maybe an increase in an ask, this will help us understand, and then it'll save us from reaching out to you and emailing back and forth, trying to understand maybe the change from last year to this year. All right. The group curriculum, this is the same as previous years. So if Starkmar funds are being requested to cover classes and or groups in this program, which type of group will be offered? And we did include an NA. So if this doesn't apply to you, if you're able to select that, that would help us. I think sometimes people checked boxes when they didn't provide classes or groups, and then vice versa. So this will just really help us know that you saw the question, doesn't apply to your program, and you can move on. But if you do offer any group, we ask that you let us know, is it treatment, education, support, prevention? And if you roll over each header, you'll see information on what the purpose is for each group. And it really is the same information from the guidance document, but it's included there as a reminder and in hopes that it'll help you determine which type of group you should be selecting. So another question. If not currently funded, will NA be acceptable? Oh, Stanley, yes. Yep. That returning providers question will not apply to you if not currently funded. So you can leave it blank or select NA, because by looking at your organization, we'll know if you're new to us. So good question, thanks. And then you'll see here a prompt to complete the curriculum eval form for each group offered. So just a reminder to do that. And okay, outcomes. This is another area that did change after the pre-release preview. So for programs that are not required to submit data into the Ohio Behavioral Health Information System, or OBIS, that's basically treatment providers. So please check the box to signify agreement with the outcomes that's in the guidance document, excuse me. So when we have that chart of all the outcome statements, if you agree to measure those throughout the fiscal year, you can go ahead and select the box. And so you will see here, applicable programs include consultation and prevention, recovery support programs, as well as those ones that have been teased out because they have different outcomes than OBIS. So your adult mobile, BH coordinator, and so forth. So for treatment programs that are required to submit data into OBIS, we do ask again to propose percentages for each outcome type. And the reason we added this back in was because we need to establish on our end a baseline for the OBIS outcomes before removing them from the template. So that's the reason, if you're wondering why that was added back in. So we do ask for those percentages as they apply to your program and the population served. So evidence-based practices and models. This has been changed from a bunch of checkboxes and lists of evidence-based practices and models to open rows. So you can type in what models are being implemented in your program. Make sure to check that PDF that outlines the supported models. Because we have that supplemental document, we felt we didn't need that checkbox list of all of the models. And also because that's not an all-inclusive list and can change, we wanted to leave it open for you to just type in what applies to your program. One more area that's kind of the narrative, but it's over to the right on the budget. I'm gonna just scoot on over here. So this only applies to an adult residential crisis stabilization unit, so CSU, and detox. So we do ask for a proposed utilization rate for each of the programs. So we do ask here, you'll see CSU or detox, and then if you are applying or submitting an RFP for adult residential, we do ask for separate male versus female utilization rate, because we know they're two separate facilities. The reason for this addition is, I don't want to get too ahead of the game, but we made changes in the budget and eliminated some sections, which is great, and hopefully you think it's great. But we need to understand this utilization rate that you're hoping to achieve throughout the fiscal year. I saw a chat or a question. It's a new program. How would a provider address the outcomes section? That's a good question, Natalie. If you see any overlap maybe in outcome statements in the guidance doc, you can check the box. I would say if you don't see anything that's closely related to the new program, you can leave it blank and we can follow up with you to establish some outcomes. That's a good question. Thank you. And we'll also transcribe the questions and answers that come in through the chat too for you all. We'll make sure we have them all together. I'm going to stop sharing because we are going to do the fiscal part of the budget and then also some other fiscal related forms just shortly. So I'm going to stop there. But are there other questions about the narrative? There's been really good ones today. Okay. I want to do a quick. Oh, Chris has made it on. Okay, cool.
Yep.
Awesome. I have one more form to walk through, Chris, if you're good, before turning it over to you.
Absolutely.
All right. I think we're doing really good on time, so that should work. So the next form is the curriculum evaluation form. So this would be if your program includes any classes or groups. So I'm going to pull up a form real quick to share with you all. Great. Okay, so we have 4 different forms. One for education, treatment, prevention, and support. So those 4 types of groups that are outlined in the guidance document that are spelled out in our RFP narrative. So you will complete the applicable form that corresponds to the type of group that you provide. And we ask for one of these pages, they're all one page, to be completed per class or group within that program. So this is the education one. And we have links here to a link, to OAC. And we ask just basic information, your agency name. Again, you can click on these gray boxes, the class, group, or name, how long it runs. And we ask some more information on your members, the training that the facilitators have had. The only thing that's new in all of these forms, except the support group, is if you submitted a curriculum evaluation last year, has the manualized curriculum changed? And that's just a yes or no. And that'll, I believe that's the only change. Sorry to double check. But otherwise, we do ask, if you do use a manualized curriculum, you would check yes, and then provide a website link or email. Some folks had sent us attachments, but you can go ahead and type right here. So again, here's that last year. If you didn't submit last year, you can leave that blank. Maybe next year we'll add an NA. And then you wouldn't need to complete anything further on this form if you do indeed use a manualized curriculum. If not, you would hit no and then complete the rest of this form. And so you'll see some guidelines here on completing it. We ask for the topics completed. And it doesn't have to be 12 weeks. We left 12 weeks there in case there is a group that runs that long, so that you can include the topics covered and then resources used for each one. And again, on the bottom, they all have this similar format of reiterating that proposals at Starkmar email address and the due date. So that's the education one. I'll just share the others so you can just see and get a visual. And they're each different colors. So the prevention is green. Real similar in structure. We tried to make it pretty consistent. So we have the link to OAC here. Similar type of information here on the top. So again, do you use a manualized curriculum? Yes, no. And there's that new question here for you if it applies. And same type of thing. So if you do not use a manualized curriculum, so please outline the topics for each group, each week in session, and then the resources. And just two more to put your eyeballs on. This is the support group. It's in the purple color. So we recognize that support group curriculum is based on recovery principles. And so this one does not have the manualized curriculum piece to it like the structured education group, prevention group, treatment group. But we do still ask for information on your group, similar overlapping items, so like trainings that your facilitators have had, and then the group name, the focus of the group, typical number of attendees. So the support one's just a little different, but we still would like information on that. And then lastly is the treatment groups. So if you are providing any groups in your treatment programs, we would ask that you fill out one for each group. Really similar in structure, just a different color. It includes that new question there. And then a breakdown of the weeks if you're not using a manualized curriculum for your group. I think that's it from my end. Any questions about these curriculum forms? Okay, Starkmar folks, did I miss anything, or is there anything you want to share about what I presented? Right. I think I will turn things over to Chris Mahaffey, our manager of accounting. He will cover the budget, personnel cost schedule, and subrecipient risk assessment. So pass it to you, Chris.
Okay. I'll start in the narrative and budget form since that's kind of where we left off. And I'll spin through the budget section, the rates. I might flip over to the personnel cost for just a second, but I will address that one separately. And then lastly, we'll go through the subrecipient risk form. So the budget section, the operating costs and revenue sections have not changed fundamentally. I could say the operating costs haven't changed at all. It's separated into the direct and indirect costs. And so for the direct costs, we list the salaries and fringes, and those direct salaries and fringes are the costs for the staff providing the service. In the indirect cost is any support staff, any functions that the staff is providing that is not service provision. It's got room for travel, supplies, equipment. I realize I'm on a filled in one. We'll go to a blank one, and then I'll use the filled in one for reference, just because for me it's easier to see the numbers in there. But as you can see, it's blank. And then there's contractual and other. And for contractual other, we do like to see some notes there, kind of laying out what those items might be. Everything else is pretty self-explanatory. And then there's a section for profit. If the program is, if you're are budgeting it to create profit, we would like that number put in there in that indirect cost section. And then I'll flip over to the filled in side just for me because it works a little easier. So in this case, you can see we have salaries and fringes indirect, and we also have salaries and fringes and indirect. Those numbers should match the personnel cost sheet that I will go over in a little bit, but I will flip over and just give you a quick preview of it right now. And in this case, you can see for this program, it looks like there's 4 staff in it in our example, and that they're both contributing direct and indirect costs to the program, and that these totals at the bottom, the direct salary and direct benefits, and indirect salary and indirect benefits, match the numbers in the budget form. And that's what we expect to see. It's kind of a workbook to let you kind of add staff to the programs that you're asking for funding, put their wages in the portions for the program, and then pull it over to this sheet. And then you've got the travel, supplies, equipment, contractual. Like I said, we could say in this case, instead of it being $10,000 in travel, that there is $700 in profit in there as well. And that keeps the kind of the operating budget right about the same. But that's what we need to see as far as numbers in those cost sections. The revenue section, we're asking for the same thing. We're being a little more specific now. So we have a Starkmar funding, but then we also listed out some actual specific examples. I think in the past we've left Medicaid, and then we had some blank cells for folks to fill out. So now going forward, we have Medicaid, Medicare, profit. How does that work? We do have some people that turn profit in some programs, and then they tend to not have profit in other programs. It usually, as for all of us, kind of washes out to be net zero game. I do appreciate the question, though, Julie. And then in the revenue section, like we said, we've got it: Medicare, private insurance, self-pay, and there is still an other if you have some other form of revenue, like maybe you have some United Way funding or some other funding in the community, and you're using that to help fund this program as well. So you can put that there. The biggest change if you're a returning provider is that this Starkmar funding piece, you just now type in the funding that you're requesting from us. It's not trying to calculate from 3 different boxes later in the budget. We're not building the budget at the bottom and having it pull up to the top. You're just going to put in the total amount of funding you're expecting Starkmar to fund. So this is a very key number here. Whatever this box says is what we're going to say, okay, this provider is asking us for $32,000 to fund this program. They're going to get the other 300 and some odd thousand from these other funding sources. The major change in the budget detail section is below. We've always asked for the non-Medicaid codes and the Medicaid codes that you all are going to be billing through to the program. But we used to ask how many units, and then it would calculate, and then you'd have to figure out a way to get that to work in the budget. Now we're just simply asking through the drop downs to identify all the non-Medicaid codes that you might want to bill in the program. And then on the right side, all the Medicaid eligible codes. And if you're a returning provider, these codes are the same group sets that are on your current rate sheet. So if that current rate set is working for you, the easiest thing to do is pull up that rate sheet. If you don't have it handy, because it's been a minute since we sent it to you, let us know. We can send them back out, and you can just use it and populate those rate sets. And then when we go through and create new rate sheets at the beginning of the year, we start with the basis of your old one. So if everything matches up, it's pretty easy on our end, and we'll double check and make sure that there aren't any new rates in, and we'll try to get those added as well. So there's no dollar amounts in here anymore. If you scroll down a little bit, we did still leave a dollar amount because we have some types of services that we still need to know how much you're going to draw down. Like we've got some programs that get some sort of administration cost, or they get an availability, or they're housing, so they get like a housing rate. We still need to know the amount of dollars you're wanting from us for those. So those are in this drop down here. So say in this program, which it typically wouldn't for this type of program, but let's say there's some sort of administration in this program. You would tell us, I need $12,000 of administration for the state fiscal year budget for this program. This number is not in addition to this Starkmar funding up here. The Starkmar funding up here should include that number and then all of the rates that you're going to pull down. This is just our way of being able to calculate those rates for you all. So in this case, if it's a monthly administration and it's $12,000, we're assuming you're going to bill one administrative code per month, and then that would be $1,000 on that code. That's really it for the budget section. It should be super familiar for folks who haven't done it before. You don't have to make the math work anymore. You just get to key the numbers in. I will pause for questions here before I flip over to the personnel cost sheet.
And Chris, there is a question in the chat, and I can answer it unless you would like to. Their question was, can we send out the rate sheet to young Christian professionals?
Gotcha. So if you're not a contracted provider with us, you wouldn't have a rate sheet. So in that case, I don't know if we have like a listing. Do we have I don't know that we have like a listing of all the Medicaid services, but if you're proposing a program that fits, Medicaid billable rates, you just want to choose those rates. If you're proposing a program that might be considered non-Medicaid, I would look through the rate menu below here and see kind of what these rates kind of line up to get as best as possible. We would end up having a discussion though, if you were a program that was not a treatment-based program and you're net new to us as a provider, you could even make the note that you left this section blank because you weren't sure how we were going to bill through or anything like that. The important part there would be letting us know how much funding you would like to receive from us, and then we can work with you to determine the best way to fund the program, especially if it's not based on treatment codes. We can talk about, do we have an existing rate that works? Do we need to come up with a different rate specific to the program? We'll have those discussions kind of throughout the process. I hope that answered the question. Great. I'll quit scrolling around idly because I don't want to make people motion sick. That's a bad habit I have. Shouldn't do it when I'm presenting. Okay, well, I will flip over to the personnel cost sheet. We kind of looked at it real briefly in a sample setting. So I will flip to the instructions tab because we do have instructions for this, and it kind of fills in what we'd like folks to put into each of the fields. And then going to the sheet itself, this is the place where you're going to list all the staff that are going to be part of the costs in a Starkmar funded program. If you have other programs that you're not asking us to fund, you may have staff that are not going to be on this list to us. My understanding is if you have other programs and you're not going to be billing them through the Starkmar at all, they don't need to appear on this list. Other Starkmar staff can correct me if I'm wrong on that. I guess we would have almost no way of knowing if they weren't going to be billing in our programs and you were using them. But this is more meant to kind of build up the staff that are going to be working in the programs we're funding, because we do ask some information about those folks. Name, position, education level, credentials, any languages spoken other than English, average number of work hours in the week, because you might have part-time staff that might have like an 18-hour work week, or 20 or 24 or anywhere in between. And then the total salary and benefits adds up to the total cost of position. And then for treatment providers, we do have a section where we have treatment models that they're certified in or using to Fidelity. And that's, these acronyms don't mean that much to me, but to other folks providing treatment services, they should. And then you get into the section of the personnel cost sheet, where you kind of help build out the personnel budgets for your individual programs you're requesting. In that example that we have on the example RFP, you'll see it ties to this. We're saying that providers only going for one program, so they've filled in the numbers for the folks that are going to be in those programs. We used to have it based on a percentage system. We got feedback that it was clunky to try to do that, and that folks would rather just key in the amounts for their people and not use the percentages and have to finagle the percentages. So we took that away. I will note that this personnel cost sheet has space for a lot of programs. I won't scroll through all of them, but I think there's about 20 programs total on here. So if you're one of the larger providers and you're asking us to fund 17 programs, there is space on this sheet to fill all of those spaces out. How will you know the percentage of employee attributed to our ask? I'm not sure I follow that. We did away with the percentage, so you didn't have to. I mean, we could do the math if we chose to, but I think it's more so like in this case, if this counselor was only 30,000. No, that's correct. Not everyone's 100%. And I will get to that. So if you have, say this counselor supervisor works in this program that you're asking Starkmar to fund, but they only work a little bit in this program, when you go over to the very far edge, you'll see that the total, it says, okay, this counselor one is getting billed through at, this amount, $37,650. So there's a variance of $40,000. What we usually have folks do, and this works kind of best for a lot of people, is we say that they should be zero. That's if they're fully utilized throughout all Starkmar programs. If they're not and they're utilized elsewhere, like you might have some administrative accounting staff that you bill as indirect cost to like 3 programs that Starkmar funds and then not to any other programs. What a lot of folks will do is take the very last program number, and I think it might be program 20, and they'll just call it overhead, or they'll call it not funded by Starkmar. And then you can put your balancing in there. And this is part of where the percentages were kind of a pain last time, is because then you had to go back and do all the math to figure out what that percentage was. Whereas now you can fill it in as best you can for how you feel people are going to bill, 50, 75, however. And then at the end, you can see what your variance is and say, okay, they're not being funded by Starkmar, so I'm going to put that in this little plug category at the end. Or we do have some folks that, they have various other subcategories on their own profit and loss statements, and they could add 3 different categories here if they want, so it matches their documentation. The biggest key for us is the sections that are listed by program, that direct and indirect salary and benefits tying out to the front of the sheet, because that kind of tells us, okay, we are including all the people in this program. We can see that this person, total cost of the positions, $80,000, and they're billing about 40,000 through to this program. So they're about half in that program. It gives us a general idea without getting into the very specific percentages. Can everyone else hear me? Okay.
Yeah, I can hear you, Chris.
Okay.
Yes.
Okay, thank you. I will stop here because I know this is one of our more complicated forms. It makes the budget form look pretty simple, but in actuality, when you start working through it, it's more of a workbook just to kind of build the budgets up of your program. I will pause for any questions that folks have on the personnel cost schedule here. Okay. I will go to the subrecipient risk form next. Okay, so this form, if you're returning, is very familiar. We've done this for several years now, and part of it's required by uniform guidance. Part of it is just part of our continued oversight of providers. It's very important if you receive federal flow-through funding from Starkmar, and a significant portion of our providers do receive that. But even outside of that, it's a good risk assessment for the RFP process for us just to get a touch base with each organization kind of every year how they are on these types of items. At the top, it's some information that's very similar to what we're asking for on like the individual budget forms, but you only have to do one subrecipient risk form. This is per organization, not per program or anything like that. You put the agency name in, your UEI number, if applicable, and that's a hot link that takes you to the sam.gov website where you can either get a UEI number, you can look up your UEI number, or you can renew your UEI number if you have one. We ask for who's preparing it, their title, and the date prepared. And then we ask some questions that are very similar to the questions that we fill out ourselves with the state about our subrecipient monitoring. And a lot of it is kind of indicated in uniform guidance. These are the type of questions we'd like to know, basically just to get a stability feel for the organization. I will say that none of these are individually disqualifying because turnover does happen. There are things that happen, audits that have issues happen. And it's more just kind of the overall combination of all these factors that we'll take a look at. The first question is just complexity. Do you use any of these Starkmar funds to meet matching requirements that you might have for other federal rewards or things like that? Does your agency receive any federal awards directly from a federal awarding agency in addition to Starkmar? And there we just ask you to list it below. We ask about the total agency staff, if you have any experience with the same or similar subawards, because there's a few folks that they can apply for the same federal subaward every year through Starkmar. And then we ask some questions about the organization. Have there been any changes in accounting or computer systems in 12 months or anticipated? Any changes in the EHR system or anticipated? Any changes in kind of upper management in the past 12 months or anticipated? And then we ask about reorganization, restructuring, downsizing, and then any major policy procedure changes in the 12 months or foreseeable future. Yes, no, and then describe. And it's if yes, please describe. If you're saying no to all these, everything's stable, we haven't changed anything, we do not need a description on that. Then we go into some management personnel stability. We ask if the administrative staff, CEO, CFO, have at least 3 years of experience, list them and the years of experience, and then the average staff turnover rate during the last 12 months. We ask some accounting questions like the method used for financial reporting during audits. Are you cash, accrual, semi-accrual? This is where your fiscal folks kind of have to work with the other folks that are filling out this form to kind of help you through these pieces. What financial software package are you using? Some of it people are using fully fledged like EHR systems with an accounting piece. Other people are using Excel and giving that information to a bookkeeper. Other folks are using QuickBooks. We just like to know what you're using there. And then we ask what EHR program's being used. And then we ask folks to self-report any irregularities, any fraud, waste, or abuse in the past year. And then if so, what were the proposed actions or what were the actions taken? And then further on the monitoring front, we ask when the last audit was, results of the prior audit, whether there was a single audit performed because that federal award threshold had been met. And then did your agency undergo any other types of reviews not listed above in the past 12 months? There might have been some other sort of review and or audit done by different organizations. And then we ask for kind of just an additional factors, and that's identify any additional examples of relevant experience with federal awards and compliance or sub-awards if applicable. So some of these could be NA, like you might not have any experience there, so you might just have an NA for this. And like I said, this is particularly important for folks that are getting federal funding. And if you are, you know who you are, but it is also important for all agencies to fill out because there's always the possibility that we have federal funds that we could use to help braid with our local funding into your programs. And we're not aware of that until we get into our budgeting season. That's why we go ahead and have everyone fill these out now. Are there any specific questions about the subrecipient risk assessment form? I know that was a lot, but it's all there, and it's. I don't think we've changed a thing on this from last year. So if you have last year's handy, that's probably a good place to start when you're filling out this year's. I will stop sharing my screen. I will note that I'm sure Stephanie's mentioned this already. If you have questions, you can send them to that RFP questions. They get routed to the appropriate individual, and we try to get back to them as quickly as we possibly can. And then they get transcribed for the greater good of all providers on the RFP website. Now is also a good time to get maybe started with these forms, even if you can't complete them, but just kind of start going through the guidance and looking at these forms, because we threw a lot of information at you in 2 hours. But there are 2 additional chances to come ask questions. And correct me if I'm wrong here, Stephanie, the next 2 sessions will focus on, hey, this is what we changed from last year to this year. So the us talking at you portion, we promise will be shorter. And
That's
then,
right.
and then the section where we just leave it open for folks to ask questions, either about what they just saw or about things that they've encountered as they've started to fill these out. That's a really great place to ask as well, because it's a live dialogue versus sending an email question in and getting that email answered. But I do encourage folks, take some time, try to digest everything we gave here today, and encourage you to re-attend one of those future sessions if you have some questions, because sometimes some great questions come out that help everyone in the room that we didn't even think of, that a provider came up with. And we took as much time as humanly possible to double check all of these changes we made, because it was significant. That doesn't rule out that there maybe isn't some little snag somewhere in these forms that we can help address as folks kind of start filling them out. All right, I'll flip it back to you, Stephanie. I don't know if you have like any closing remarks for the good, but I'll be quiet now and let you go.
Chris, those were great closing remarks. I don't have much after that, but I just want to say thank you to everybody for your time today. I know this was a lengthy presentation, but we appreciate you being here. Again, really good questions were asked, so thank you. That helps us improve things for next year. Again, this session will be recorded and will be uploaded to our YouTube channel here shortly, so you can reference it. And again, email us or come to our next Q&A if you have any questions. But that's all we have for you today. Thanks again for your time. Have a great rest of your day.